Good afternoon. I'm Caxenais Alicia Torres, a Health Communications Officer with the Division of the Environmental Health Science and Practice in the National Center for Environmental Health at the Centers for Disease Control and Prevention. I'd like to welcome all of you to today's Environmental Health Nexus webinar, Public Health in National Parks, Plan a Healthy, Injury, and Illness-Free Visit. There will be a presentation and a Q&A session with panelists. All participants joining us today are in listen-only mode, and closed captions are available for this webinar. Next slide. Today's Nexus webinar will be available to view on demand in a few days. You can find the video recording of today's webinar at the CDC Nexus webpage at cdc.gov/nceh/ehsb/ehnexus, or you can scan the QR code. Next slide. You may submit questions at any time during today's presentation. To ask a question using Zoom, click the Q&A button at the bottom of your screen, then type your question in the Q&A box. Keep in mind that we often get more questions that we can answer in a live session. If you're a member of the media and you have a question, please contact CDC Media Relations at media@cdc.gov or at 404-639-3286. Next slide. Please note, the findings and conclusions in this report are those of the authors and does not necessarily represent the official position of CDC. Next slide. Well, I want to welcome our presenters for today's Nexus webinar. We are pleased to have with us Captain Sara Newman. She is a captain in the United States Public Health Service and has served for more than 30 years in public health positions. She is currently the director of the Office of Public Health at the National Park Service, where she leads public health protection, disease prevention, health promotion, and emergency response policy and programming impacting the health of more than 300 million visitors and thousands of employees in more than 400 parks nationwide. We also have Captain Kurt Kesteloot. He works as a team lead for the National Park Service Office of Public Health Field Services Branch and is an active duty engineer officer in the United States Public Health Service. He supervises up to 4 officers and works with them to conduct on-site drinking water, wastewater, food safety, recreational water, and vector zoonotic disease inspections at hundreds of parks in the Midwest and Eastern U.S. We also have Captain Christen Glime. He currently works as a team lead at the National Park Service Office of Public Health Field Services Branch. He's also an active duty engineer officer in the United States Public Health Service, and in his role, he supervises up to 4 officers and collaborates with them to perform on-site inspections for drinking water, wastewater, food safety, recreational water, and vector zoonotic diseases at hundreds of parks in the Midwest and also at Eastern U.S. We have with us Ms. Jennifer Proctor. She's a registered professional engineer and retired Public Health Service commissioned officer and is the branch chief for the National Park Service Public Risk Management Program. She leads the national level program that provides guidance and technical assistance on the prevention of unintentional visitor injuries in national parks. We also have with us Ms. Ina Heisey. She is the Injury Prevention Specialist for the National Park Service. In her role, she manages the Visitor Injury Data System, leads the development of risk communications, including national level safety campaigns, and her favorite part, provides technical assistance to parks. And last but not least, we have Captain Danielle Buttke. Danielle is a wildlife veterinarian and epidemiologist who leads the One Health program for the National Park Service. Her research interests include ecological drivers of disease, including the greatest public health threat of the century, the climate crisis. Prior to joining the National Park Service in 2012, Danielle served as an epidemic intelligence service officer at CDC's National Center for Environmental Health. Thank you to all our presenters for your service and for being here today with us. Now I'll turn it over to Captain Sara Newman. The floor is yours.
Thank you so much, and thank you to the Centers for Disease Control and Prevention for having us here. We're really excited to talk to you today and to hopefully give you some information about the work that we do at the National Park Service and have done for many years actually to help visitors plan a healthy visit and an injury and illness-free visit. We hope, we could go to the next slide, we hope that by the end of this session, you will understand this partnership between the National Park Service and the United States Public Health Service. We hope you'll learn about the power of our parks for promoting and protecting health. We hope that you can utilize and share the resources we will discuss today on how to plan an injury and illness-free visit to a park. We hope you'll understand some of the key considerations to prevent injury or illness while recreating in national parks. And finally, we're going to be here afterwards to answer some questions you might have. Next slide. You might notice as you read the mission here of the National Park Service, there is nothing here specifically about health or risk management. Although I might argue that it is implied. Notice the emphasis on enjoying parks, which appears twice in this mission. You can't really enjoy a park visit if you're injured or if the visit makes you ill. And although it's not clearly highlighted in the mission, a main impetus for the creation of park land in the United States was rooted in public health. Please go to the next slide. Our nation's first parks, such as Hot Springs National Reserve, Yellowstone National Park, and even New York's Central Park, were seen as sources of clean air, clean and therapeutic water, as well as places for enjoyment, places to escape the stressors of city life and to derive health benefits. The architect of New York's Central Park, one of our nation's first urban parks, was Frederick Law Olmsted. He was also a sanitarian, and he considered this park to be the lungs of the city. Next slide. In the second annual report of the National Park Service, that was in 1918, which set the agency policy, the first National Park Service director, Stephen Mather, noted that parks, quote, are set apart for the use, observation, health, and pleasure of the people. But not only did he see parks as a health resource, he also wanted to ensure parks were not a source of illness. Next slide, please. So in 1920, the superintendent of Yellowstone National Park requested the assignment of an officer of the Public Health Service to, quote, and I'm reading this telegram here, to come here at once to inspect some very serious sanitary situations. Send a man qualified to make comprehensive and practical suggestions for improvement. The other improvement in the Commission Corps is that we now have women, not just men. But today we still inspect Yellowstone, and we have nearly 70 other officers providing public health guidance and support in over 420 some parks across the nation. The partnership between the National Park Service and the U.S. Public Health Service is said to be one of the oldest agreements between two federal agencies. Really interesting. Next slide. The National Park Service Office of Public Health still carries out the activities we were asked to do more than 100 years ago. We inspect systems to ensure that they meet regulatory requirements to provide, and we also provide technical assistance in food safety, drinking water, wastewater, recreational water, and for operations, both heavily populated with visitors, and even in those in the far corners of the parks in our backcountry, sometimes requiring our staff to raft, to hike up mountains, to traverse rivers and trek through snow, meaning their own safety is something that is of concern to us. Our staff are not regulators. We provide technical assistance. We also have a role in supporting outbreak investigations and response for infectious disease and spread of infectious diseases or zoonotic disease concerns. You will hear from our staff, from our office about the work we do to prevent illness. And given the clear and growing evidence of the health benefits of parks, I'm also proud that our office and the National Park Service supports programming to support promoting our parks as a health resource, such as our Healthy Parks, Healthy People initiative and our Your Park, Your Health program. And the National Park Service is dedicated to preventing visitor injuries. So you'll hear from my colleagues in our National Park Service Public Risk Management Program, and they will, next slide, please. They will speak with you today about their work to help parks prevent injuries by building staff capacity through tools and guidance and facilitating partnership both within the Park Service and with partners, like many of you there, out here, and through education and communication with visitors. The work we do to promote and protect health under the Park Service mission requires us to consider the impacts our recommendations make on the resources the National Park Service is mandated to protect. So you'll now hear from Captain Danielle Buttke, a veterinarian and epidemiologist, who will tell you a little bit more about how we do this. Captain Buttke?
Thank you so much. So as Captain Newman highlighted, we perform a lot of the functions of a state or local health department, in part because we often have federal jurisdiction, so exclusive jurisdiction on the lands we steward. And if you were to add up all of those park units we're looking at, I think the number today is 429, it would be equivalent to the 5th largest state in the United States based on land mass alone. However, we actually welcome over 330 million visits most years, which includes significant international populations, folks from all over the country, 20,000 employees, and 300,000 volunteers who often, next slide, all visit the developed areas of the parks, which means they're oftentimes somewhat crowded in rather small spaces. With all kinds of different potential interactions and activities and ways in which they may encounter different risks, including infectious diseases, whether they're vaccine preventable or not. Remember, again, these populations are coming from many different locations to a single small location. So we do see measles, hepatitis A, norovirus, etc. We also, because of the activities and the environments in which these visitors enjoy our parks, there are risks for zoonotic or vector-borne diseases, whether it's plague, tick-borne illnesses, rabies, etc. They're rare, but they're important, and the risks in parks may differ. We also see waterborne diseases, in part, again, because of the unique activities people participate in when they visit our parks. and even environmental exposures, including uranium, radon, et cetera, not only for visitors to some of these unique locations, whether it's caves, abandoned mine sites, et cetera, or our employees who are conducting the stewardship of these places on their jobs. We also, unfortunately, see a lot of injuries from the traditional sources of injuries that plague most citizens in the United States, from motor vehicle crashes, drownings, falls, heat illness, animal bites, et cetera. So it's important that we have our public health officers and our Office of Public Health ready and available to respond to these issues as well as prevent them whenever possible. Next slide. This means, however, that we have to conduct these activities under the broad mission of the National Park Service, which, as Captain Newman mentioned before, really focuses on conserving the scenery, natural and historic objects, and the wildlife therein, and to provide for the enjoyment of the same in such a manner and by such means as it will leave them unimpaired for the enjoyment of future generations. What this means in practice, next slide, is that we can't simply come in and say, what is the best way to protect humans? We have to instead weigh all of our options that include both human health benefits as well as the benefits to the resources in the parks that we're stewarding. And Congress has provided that when there's a conflict between conserving resources and values and providing for enjoyment of them, conservation is to be predominant. The two photographs I have presented in the slide here highlight two effective means of preventing mosquito-borne diseases. On the left, you can see the spraying of DDT on a historic beach, that's now, I believe, part of one of our National Park Service units near Fire Island National Park, if it isn't actually part of it. Really effective at stopping mosquito bites the day that DDT is applied. However, on the right, you see a very effective and oftentimes more effective, because it doesn't require repeat applications, means of preventing mosquito-borne illness. One of these two options is much less impactful to the environment and may actually result in longer-term reduction of mosquito-borne illnesses because it's not killing off predators and other key aspects of that ecosystem that may regulate certain aspects of vector-borne diseases. Next slide. When we think about these issues holistically, we also have to remember that the World Health Organization has stated that nature is actually the greatest source of health and well-being for humans. And that means the more we can protect and think of the ecological health of these spaces, the better off our health will be ultimately. All parks, urban and wildland, are cornerstones of people's physical, mental, spiritual health, social well-being, and the sustainability of the planet. This is what our Healthy Parks, Healthy People program really emphasizes and promotes, that parks are intended as health resources. And the better the health of the park and the nature around us, the more healthy we are as people. Next slide, please. This is essentially what One Health is. It's recognizing that human, animal, and environmental health are all linked, that our health is dependent upon the health of the land, air, water, and other species. And when we think about this connection, we find a lot of new opportunities to both see our personal health benefits and our community health benefits from celebrating nature that can also actually improve the health of those other species we share these spaces with, or these other non-human relatives we share these spaces with. It's important, though, to think about when you're entering these spaces that these non-human relatives and these natural spaces have unique risks and require a little bit of planning in order to fully enjoy them safely. And so now I'm going to turn it over to Ina Heisey, who is going to present and highlight to you the ways in which you can make the most of your visits to our national parks by thinking about planning for your trip and recognizing some of the hazards that you can avoid, provided you think about them before you venture out.
Thank you, Captain Buttke, and we can go to the next slide. So one of the best things national park visitors can do to reduce their risk of illness or injury while recreating outdoors is planning. Based on our data and anecdotes from the field, there are 3 common mistakes that often lead to illness and injury. The first one is visitors are not familiar with the park they will visit. Recreating in the hot and humid swamps of the Everglades is very different from recreating at 7,000 feet elevation at the Grand Canyon. So we recommend that visitors visit the park's website on nps.gov to learn about and prepare for elements such as the weather during their visit, wildlife they may encounter, water conditions, and available amenities such as potable water and bathrooms. The second mistake is visitors exceed their limits. We recommend that they pick an activity that meets their current skills, outdoor experience, and fitness level. And when traveling in a group, it is so important to assess these elements for each person in the group, because ultimately the best adventure is the one that everyone can complete safely. And there's more than one way to experience a park, from hiking and camping to exploring museum collections and bird watching. There truly is something for everyone. The third mistake we see is that visitors do not have the right equipment for their activity. And depending on the activity and the park setting, these items can look different, right? So if you're going hiking, that might mean that in addition to the 10 essentials, you are wearing sturdy shoes and packing bug repellent. But if you are rafting, that may mean that you also have a life jacket, a helmet, and water shoes. And speaking of water activities, if visitors are recreating in, on, or around water, it is crucial that they check water conditions and make sure that they are suitable for recreation. Rivers, lakes, and oceans can have hazards such as strong currents, harmful algal blooms, and even sudden drop-offs, just to name a few. All of this can really impact the health and safety of our visitors. Next. So to help visitors avoid these common mistakes and more, we have developed the NPS Trip Planning Guide, which can be found on the Health and Safety site on nps.gov. This is a wonderful tool that visitors can use to plan a healthy and injury-free trip to any park and for any activity. By following the recommendations in this guide, they will also help protect and preserve the natural, cultural, and historical resources of the park, which Captain Buttke was just talking about. We have divided the timeline of a trip into 4 phases: before the trip, arrival at the park, during the trip, and after the trip. And this guide provides visitors with tailored safety recommendations for each of these phases. Now, while all visitors can benefit from the information in this guide, the target audience is visitors with little to no outdoor experience who are planning a day-long or overnight trip to a park. Next. So just to give you a taste of the NPS Trip Planning Guide, on this slide, I have included the first page of the 2 phases. That's the before the trip and arrival at the park. You can see that we have used imagery in the headers of each section to place the visitor in the right setting. And we are using color as a visual cue when moving from one phase to the other. You might notice that the recommendations in Know Before You Go, such as learn about the park, know your limits, might look familiar, right? Because they are directly tied to the common mistakes that we just talked about. Next. And here we have during the trip and after the trip phases, which feature recommendations such as keeping a safe distance from wildlife, sharing your experience, including lessons learned to help others prepare for their adventure. Next. In addition to the NPS Trip Planning Guide, we have also developed 2 supplementary tools. The first one is a sample trip plan, and this is a fillable PDF that allows visitors to tell a trusted contact where they're going, what they will be doing, and when they will be back. A trusted contact is someone who is not going on the trip with them and who can alert authorities in the event of an emergency. The goal here is to provide authorities with key information to help respond quickly and effectively in case there is an emergency. The second tool here is the Outdoor Emergency Plan. This provides recommendations for how to prevent becoming lost or injured and what to do if you or someone in your group does become lost or injured. Next. Lastly, I want to share with you the Junior Ranger Park Explorer booklet, which is a kid-friendly version of the Trip Planning Guide. It uses fun games and activities for children of all ages to learn the same principles as we saw in the Trip Planning Guide. And really, this is a great opportunity not only to educate the next generation of park stewards, but a clever way to involve the adults who will be traveling with them. Next. The Park Explorer booklet, along with the sample trip plan and the outdoor emergency plan that I just showed you, they can all be found on the health and safety website. This is a public-facing website that serves as a hub of all safety and health promotion information. We have organized the trip planning content by activity, such as swimming and camping and biking, and by hazards, such as heat and wildlife. So this will help visitors find information that is relevant to their specific trip. The disease prevention topics on the website, from anaplasmosis to Zika virus, have been alphabetized, so they're easy to find. And we have 2 full pages that speak to the benefits of parks for health and help visitors find events near them. Next. So all the trip planning content that I have shared with you so far are developed and managed by the national level programs. And now I'd like to shift the focus to how parks are helping visitors plan for their visit. Every national park has its own website on nps.gov, and all of them have a Plan Your Visit section. This is truly the best place to obtain park-specific information. And in the graphic on the right side of this slide, I have highlighted in yellow boxes 3 sub-pages under this section. The first one is basic information, which helps visitors learn about park conditions like weather, wildlife, etc. Things to do provides a list of available activities at the park, along with specific safety information such as seasonal changes, difficulty level, and recommended gear. And lastly, there is a safety page, which has information about hazards visitors may encounter at the park and how to plan for them. Next. On each park's website, visitors can also find the alerts and maps pages, which are highlighted with a red box on the image at the top of this slide. For today's presentation, I am using the Yosemite page as an example for us. So the alerts page has the most up-to-date information about park conditions, including imminent hazards such as extreme heat warnings, flood events, and poor air quality, closures of roads, trails, and even park areas, changes in available amenities such as potable water and bathroom, all of which are really important to planning a trip to a national park. The maps page provides visitors with a digital map of the park where they can find key information such as where can they purchase or refill their water bottle along their planned route in the park. Visitors can also pick up a physical map at the visitor center or ranger station once they arrive at the park. Now I will hand it over to Captain Kesteloot, who will talk about food safety and waste management in parks.
Thank you, Ina. So now after you've hopefully planned everything the way you would like for your trip, you can dive into a little more specific details on what we work with on our program. So before your trip for food safety, some of those maps that were shared earlier from Ina and others, you can look at the maps to know where the food might be available, and check the park website for regulations on hunting or gathering if that's something of interest. Gathering might be if you're talking about collecting any sort of blueberries or raspberries or any sort of fruits that might be in parks. Some parks that's allowed, and there's certain regulations on that, and others it's not. So just check those out before your trip so you can be prepared for that. And then during your trip, you can look at your again, look at your park maps, and you can see those designated food establishments. Our program goes through and inspects those food facilities. As mentioned earlier, we do our FDA food code latest version typically is what we use for our food inspections. And with that, you can rest assured that any of those designated food establishments have been inspected by our program and should have a good choice of food options for you that are safe. And, you know, if you're continuing to have your own food while you're on site, please make sure you keep those at proper temperatures, wash hands, and do not litter. Make sure you keep control of that solid waste. And as far as the proper temperatures, just a brief overview on that, making sure those temperatures are below 40 degrees if you're keeping things in cold holding. And if you have something that you're keeping hot, you can hold that at 135 degrees or above. And then in between those temperatures, you only have a couple hours between 135 and 70 degrees Fahrenheit. And then from 70 to 40 degrees Fahrenheit, you have another 4 hours. And after your trip, hopefully no one gets sick and you enjoyed your food establishment. And if you had any public health concerns or someone did get sick, please feel free to contact us at the website shown here. Next slide, please. So after you've enjoyed your meal, hopefully there's several hours in between there that you've been able to enjoy the park. And at this point, you're probably trying to find a bathroom. So before your trip, make sure if you're going on these large hikes to not only know where the water is that was mentioned, but also know where you'll be able to go to the restroom safely and provide proper sanitation and sanitary conditions for everyone else. So make sure you check where those are and plan to leave no trace. I'll give a little more detail on that. And so during your trip, use the restrooms whenever possible. In emergencies, there should be signages at the front of the trailhead or throughout the park or on, say, your park pamphlet that you may have gotten at the visitor center that will talk about everything. Make sure if you have solid waste that you keep that with you. Don't dispose of that in vault toilets. If you are in an emergency situation, you can look at digging a hole. And I just spoke with our wilderness program lead here a couple of days ago, and the depth of that is about 6 inches. And also making sure that if you are doing that, it's in an area that's, remote. There's no other options. That's certainly don't want you doing on a trail, very close to a trail. Make sure that you have proper distances from anywhere that you feel like might be a heavily populated or used area. And then never leave biosolid waste or trash, toilet paper on the ground or in the parks. Please make sure to keep that and dispose of that properly. So after your trip, again, similar to food, hopefully you didn't get sick. Hopefully you may have found a nice clean restroom, and also if you have noticed a public health concern in any of the restrooms, make sure you keep that in mind and try and notify our program so we can make sure we talk to the park and help address that concern. Next slide, please. So after you've found a few more details on planning for your trip and you know a little bit more about restrooms, here's what they might look like. So you see on the far left here, or lower left, you'll see a typical vault toilets, and you'll see there's also portable toilets outside that. Sometimes you'll see the portable toilets outside because maybe that vault toilet's unable to keep up due to visitation numbers, or maybe the one toilet isn't ADA accessible. You see the one on the right there in that same lower left photo is a ADA accessible portable toilet. So you might see those, and then in the middle you're going to see, and that might be similar to what you might see at the Weeping Rock here on the right would be that vault toilet on the left. But then if you're looking at the middle photo, that would be a facility. You can see the drinking water, the faucet there for a water bottle filling station along with the drinking fountain. That's something that you might see similar to the Temple of Sina Wave or the grotto area where you see the image where it shows a male female restrooms and then also a picture of water. So you're going to have flush toilets in those type of locations. So hopefully you can plan accordingly and be able to fill up with water there and use the restrooms as needed. Next slide, please. So this is a little bit more on the leave no trace principles. You can see the trademark there on the far right, and the main thing as far as the solid waste or biosolids that we're concerned with is, as we mentioned, know before you go, choose the right path, and keep your trash and leave what you find. So as far as the trash, the wag bags, well, they're often referred to similar to a bag that you might use for picking up the feces from your dog or animal if you're walking them out in public. So keeping that with you and then bringing that to a proper disposal location. some sort of solid waste, similar where you might bring all your trash. So all your trash and your biosolids, please do not put that, even though it might make sense to you to put it in that vault toilet. Those vault toilets, if we put bags inside those, it's very hard to for the septic company to get out there and break that apart and then actually suck that out of the vault toilet. So please don't put any trash down the toilets. With that, next slide, please. I'm going to turn it over to Captain Chris Glime, who's going to talk about drinking water.
Thanks, Captain Kesteloot. Yeah, let's talk a little bit about drinking water. So our program does inspect all of the water systems in the national parks. We have about 1,400 water systems in the Park Service, so quite a few for us to keep an eye on. And like Captain Newman mentioned at the beginning of the presentation, we are not regulators. So these water systems, if they are public water systems, they are inspected by the regulatory or the primacy agencies. But our office, while we do keep an eye on regulations and help parks and consult with parks to meet regulations, we're really inspecting the water systems in more of a public health lens to protect public health and looking at things that may be more public health concerns than regulatory concerns. The other thing that we want to make sure for visitors is that anywhere where you can get potable water is clearly marked. So you can see the picture on the right. We have a good signage there at an RV dump station on where you can get potable water there. And then almost more importantly is areas that you're not supposed to drink the water. If we have water systems that don't meet requirements or don't meet drinking water standards or they're not treated properly, we want those signed to be non-potable, and you'll see that on the picture on the left there. Next slide, please. So before you go to a park, again, I know we keep saying this, but check the park website to make sure you know where you can get drinking water. Well, first of all, I guess if you're going to be in the front country, that's what we refer to as areas that most of our visitors go to that are paved, or you're going to visitor centers, and most of those areas you will be able to have access to potable drinking water. I think more of the challenge is going to be if you're going to be going out into the backcountry. So most hikers, I think if they're going out on multi-day backpackers, generally understand that they need to treat water out of creeks and streams and things of that nature. But we do have a link here showing how to treat water in the backcountry. And essentially the biggest recommendation there is to make sure it's filtered and disinfected. And as we've kind of said throughout here as well too, is if anybody gets sick and they believe it's from any of our drinking water systems, we do hope people report that to us so we can make sure that that we look into that particular situation. Now, when I said check the park website, the picture you see here on the right is a picture of Grand Canyon where it shows the South Kaibab Trail. And in this particular alert, it does say that one drinking water fountain along that trail is closed. So, hopefully you would see that and would not be planning on getting drinking water from there. Next slide, please. So I'm going to talk a little bit about recreational water facilities now. So let's talk a little bit about pools, hot tubs, and spas. We don't have a lot of these in the National Park Service, but we do have about 25 swimming pools, hot tubs, and spas. So our office does inspect these facilities according to the CDC Model Aquatic Health Code to make sure that those recreational water facilities are safe and meet standards, and that nobody's going to get sick by swimming in those facilities. Next slide, please. Now I want to switch over a little bit to natural bodies of water. And so in terms of recreational water for natural bodies of water, we're really concerned mostly about areas where people are going to frequent, where people are going to swim and be concentrated, such as designated bathing beaches. So wherever we have these bathing beaches where a lot of people are going to be concentrated and using them, we do work with parks to make sure they're conducting bacteriological water testing to make sure that the water meets recreational water standards. We do use the EPA's recreational water quality criteria. Unless a state has a more specific requirements, then those are used. And If any of those results show bacteria levels that are above acceptable public health levels, we will work with the parks to either sign that beach to indicate what the risk is to visitors, or actually close that beach to make sure people aren't swimming in there. So before you go out to a park, again, you just want to check the website, see if you see anything about any closures like that. And then, of course, while you're out in the park, if you see that, you see something posted, please don't swim in it. It's posted for a reason. And again, if anybody gets ill from swimming in any of these areas, we want to make sure that they report that to our program. Next slide, please. I'm going to turn it over to Ina to talk a little bit about injury prevention in these specific waters.
Sure, thank you, Captain Glynn. So we will focus again on preventing injuries this time in natural bodies of water. And as you heard me say earlier, planning is key. So let's start out with recommendations for what visitors should be doing before they even head out to the park. Here we are again, where we are recommending visiting the park's website, because again, that's where you'll find very important information, such as what water activities are even allowed at the park. Every park is unique in recreation opportunities, so it's important to know this before you even head out and making your plans. Once the visitor has picked their activity, it is important to learn about park conditions that may impact their plans. So for example, what's the weather forecast? And is it even safe for water recreation? Are there any active park alerts, such as hazardous water conditions or closures that might impact your visit? What are the water conditions at the park? Thinking about currents, wave heights, water temperatures. And does the park have designated swimming areas with lifeguards? Because if so, you should definitely plan to recreate in those areas. Before heading to the park, it's also very important to pack a life jacket with you. We do have a few parks that have life jacket loaner stations where visitors can borrow a life jacket for free and return it. However, loaner stations may not have their size or be out of life jackets altogether, so you cannot really count on them. Lastly, before heading out, we recommend that you fill out the trip plan that we talked about and leave it with a trusted contact who is not going on the trip with you. Once visitors arrive at the park and they're enjoying their activity in the water, whether that's swimming, boating, or fishing, it's important to wear a life jacket. It can really help prevent drowning, keep you afloat if you get tired, and give you time while waiting rescue in the event of an emergency. If the group of visitors includes children or people with little to no swimming abilities, we also recommend that they designate a water watcher. This is an adult who supervises them and stays within arm's reach at all times. As I mentioned before, if there are lifeguarded areas, we highly recommend that visitors recreate around there. And lastly, it is important to keep an eye on the weather. Nature is unpredictable, and what can start as a warm sunny day can quickly turn into a storm that makes water conditions hazardous for recreation. So visitors should always be prepared to go back to shore. Now, once visitors have returned home from their fantastic adventure, they should check in with their trusted contact and let them know that they have made it home safely. And with that, I'll pass it over back to you, Captain Glynn, to talk about zoonotic and vector-borne diseases.
Great, thank you, Ina. So yes, our office also does consult with parks on zoonotic and vector-borne diseases. As you can imagine, these wild, beautiful places that people come to are going to have some vector-borne diseases of concern. And while some of our visitors might understand if they're going to perhaps the Northeast or the Midwest and they're going to be in heavily wooded areas, they might expect to encounter wood ticks. We might have visitors that are going to places or parts of the country, or even international visitors, that have no idea what type of diseases of concern they might run into. So again, before you go to a trip or go on a trip to a park, you want to check that park's website. In this particular park in Idaho, it does alert visitors to ticks being an area of concern and gives them some recommendations on what to do to prevent any illnesses from ticks. Next slide, please. So during your trip, you know, I guess to step back a little bit too, if you're going to a park and you do know of some vector-borne diseases of concern that you might run into, for example, plague or or mosquito-borne illnesses. We do have on our website these health topics from A to Z, and you'll be able to go into each specific vector-borne disease to kind of see what the prevalence of that vector-borne disease is in that area. And we give recommendations on there about prevention measures you can take, from wearing long clothes, staying on trails, wearing or treating your clothes with permethrin for different insects, and using bug spray. But during the trip, you just definitely want to follow any mitigation measures that are recommended to protect yourself from those diseases. Next slide, please. And then, as always, this is a common theme. We want to make sure people, if they do get a vector-borne disease on one of their visits to our parks, we want to make sure that they report that to us so that we can investigate that and try to prevent that from happening as much as possible in the future. We can't prevent everything, obviously, because these are beautiful wild places, but we do our best to try to minimize risk where we can. Next slide, please. And with that, I wanted to just show there's a few links here that people might find helpful about our program and our parks. And I think with that, I'll turn it back over to the moderator. Thank you.
Thank you to all our presenters for providing our audience with this important and timely information. We'll now go into our Q&A session. To ask a question using Zoom, click the Q&A button at the bottom of your screen and then type your question in the Q&A box. If you're a member of the media and you have questions, please contact CDC Media Relations at media@cdc.gov or at 404-639-3286. I would like to ask the National Park Service team if they have additional important information that you'd like to share with our audience today. No, all good. Sarah?
No, I don't think so. Any questions we're happy to take, though, for sure.
Yes, we have one question. And I will ask Captain Kesteloot to join me in moderating this part. We have two questions in the Q&A box.
Thanks. So I see the first question here is, how often are health topics updated to ensure latest prevention and mitigation recommendations are included? That's a good question. I'll provide somewhat of an answer, and then I'd say Captain Newman and Captain Buttke may have a little bit more to add on to this. But we have our EPI branch. I would say we try and look at that at least every season for sure. We try and update that information, and if there's anything urgent that would come out, if there was an outbreak or something, we would likely update that within within a month or so, I would imagine. Or even sooner. Captain Newman or Captain Buttke, anything to add on that?
Yeah, I'll just really quickly, and then I will pass it to Captain Buttke, say, yeah, we can't do the work we do without the CDC, to tell you the honest truth. We rely, and we actually have an MOU with the CDC that allows us to do collaborative work in a number of areas. And so we do it not only with the Office of Risk Management, the Office of Public Health, and even some of our other divisions in the National Park Service that engage on a whole range of activities. I couldn't even begin to articulate some of them now. What I will do is turn it to Captain Buttke because of her role with our epidemiology program, and when we do have an outbreak and how we engage with the CDC, and I know she'll have a few examples to share, so let me pass it on to her.
Thanks, Captain Newman. Absolutely. There are certain branches we do end up collaborating more with, and that's largely based upon the subject matter we're dealing with. So in the spring and the fall, we often collaborate really closely with the norovirus branch, the rabies branch for specific topics, and then the vector-borne disease division, both the Fort Collins group as well as the dengue group in Puerto Rico. You know, a lot of the diseases that we're dealing with are often ones that have prolonged incubation periods. And so quite often people may get exposed to the park and then they don't get sick until they get home or they're at a different location. And so much of our work requires this cross-jurisdictional, collaboration, both with local health departments, state health departments. And then when there are very specific topics, diseases, or multiple jurisdictions involved, that's usually when we reach out to and work directly with CDC. A lot of our research as well in zoonotic and vector-borne diseases in particular is done through close partnership and collaboration with CDC, since it's such an opportunity to use parks as living laboratories to, again, better understand the ecology and the drivers behind a lot of the diseases that we're concerned about and that we monitor really closely in our parks. And then back to Kurt's point about, those park alerts, when we do have an unusual event, an unusual disease, or a risk that we've identified that's different from what we would normally expect, or indicative of heightened risk, quite often those parks are updating those park alerts on a daily basis, to really let people know about something that's changed, something that's different. And then the other thing that I find personally those park alerts really helpful for is to figure out when things are closed, right? Because a lot of our parks can only do road construction in the summer, or they can only deal with, water system repairs, right, during the summer months. So make sure you're paying attention to and monitoring those park alerts.
Yeah, if I may chime in from the injury prevention standpoint, as far as how often do we update our information, we are very lucky to have great partnerships, not only with the CDC, but NOAA for weather information, NHTSA for traffic safety, the U.S. Coast Guard when it comes to boating and life jackets and so forth. So as science changes, as we learn more, right, we also update our national level information, like on the health and safety subject site. As far as collaborating with the CDC from the Office of Risk Management standpoint, we have worked very closely with their Injury Prevention Center, not only in learning about the model that they are using to help states prevent drowning and motor vehicle crashes, the latest safety recommendations on injury topics, but also in data collection and analysis. How are they coding data so that when we are doing our own data work, we can align with industry best practices? So very close partnership with the CDC.
Thank you, everyone. And the next question, I think we pretty much answered already, but the question was, we've mentioned that we collaborate with, we being the USPHS, collaborate with the CDC more. And how do we do that? How much more broadly do we do that? Other particular branches? So Captain Buttke already mentioned a few. So we've also worked with the Legionella group and the wastewater surveillance group. And I don't know if anyone else has any other groups they would like to mention for the CDC partnership that we have.
There's so many. I'd have to go actually back and look at a list, because again, we rely on, as CDC being the scientific health organization of our nation. We only have, as you can see, we don't have a lot of officers and staff doing public health in 429 parks across the nation, impacting 300 million people. So on a number of issues, whether it's health promotion, protection, prevention, injury, or illness, we will reach out on a number of issues on a whole. I could go back and get all the institutions and names, but it's many, and we are absolutely grateful. I mean, we're on right now a stakeholder heat illness that includes CDC, and we collaborate on that. So there are a number of them, and again, we couldn't do it without CDC. We couldn't do it without our local and state health departments. So our office, whether we're in the Office of Risk Management or Public Health, need to collaborate with those experts in the field to ensure that we are addressing the issues that we have at hand with all the tools and resources available to us. So we do reach out to our partners at the CDC, EPA, NOAA. You've heard some of them mention, who have this expertise that we can draw upon.
Thank you, Captain Newman, and thanks everyone for pretty much answering that as we were going on the first question. So our next question is, how much of your time does the NPS dedicate to plan reviews to ensure that the parks have built environments that follow the public health standards and the best practices. So I think I'd like Captain Glime, if you want to chime in on this one.
Sure. Thank you, Captain Kesteloot. So just so everybody understands, we do plan reviews of any new food facilities or any renovations of food facilities to make sure they meet the FDA food code regulations. In addition to that, we also do plan reviews for water and wastewater facilities, be it new facilities or renovations. So, and it just depends on the time of year and the funding cycles. It's hard to put a percentage of how much time we spend doing that. But I would say, 50 or 60% of our time is just doing these inspections and writing reports. And maybe 10, 20% of the time we might be reviewing plan reviews. I know I'm reviewing a lot of plans right now because of a big funding increase that we've seen, but it kind of is all over the place. But we do those plan inspections to make sure that facilities get built properly right out of the gate, so we don't have to make
Thank you. Thank you. We'll go to the next slide, please. Well, this concludes our Q&A session for today and today's Nexus webinar. Thank you all for joining us, and a special thanks to our presenters from the National Park Service, Captain Newman, Captain Kesteloot, Captain Glime, Ms. Proctor, Ms. Heisey, and Captain Buttke for their insightful presentations. Take care, everyone, and have a great rest of your day.